50 years old man is admitted after falling from scaffolding. He has open fracture of the tibia with a 15 centimeter wound, but the neurovascularity is intact. What is the best course of the action? So a 50 years old man suddenly fall and he developed the open fracture of the tibia with 15 centimeter wound. That means it is the Gastello-Anderson type 3 wound, and neurovascularity intact. That means it is not type 3C, it may be type 3A or type 1 or type 3 2. So what is the best initial management? Here the options are the intravenous antibiotic, photography, application of saline soak gauze with impermeable dressing, throughout wound debridement in emergency department, combined skeletal and soft tissue reconstruction on a scheduled operating list, application of external fixator and conversion to internal fixation after 2 weeks, immediate skeletal stabilization and application of negative pressure dressing. So what may be the option? First of all, let's see the Gastello-Anderson. So this is the Gastello-Anderson system of a fracture. Here we can see this is the grade 1 or Gastello-Anderson type 1, type 2 and type 3, or grade 1, grade 2, grade 3. In grade 1, the wound size is less than 1 centimeter. So there is minimum wound. In case of Gastello-Anderson type 2, the wound is greater than 1 centimeter. And there is moderate soft tissue damage. And in case of Gastello-Anderson type 3, there is a high energy wound more than 10 centimeter with extensive soft tissue damage. And the 3, that means type 3, is also classified into the 3A, 3B and 3C. In 3A, there is adequate soft tissue covering present. So in case of type A, there is also there is wound gap is very less, and in case of type 3B there is inadequate soft tissue coverage, and in case of type C it associated with the arterial injury or neurovascular injury. So the type 3C is most dangerous. Now, some important key point for managing the fracture. First of all, remove obvious contamination from the wound. This is very, very important, that any contamination we should remove very early. Then wound lavage should usually be given by in OR, that means operation room. Early wound photography should be performed. Complex case referred to the center that provide orthoplastic care. All wounds should be managed within 24 hours. Actually, this is as early as possible. We have to manage the fracture as early as possible, because when there is time going, there is a chance of infection. And a high velocity one within the 12 hours. And those with vascular compromise should manage immediately. That means in case of vascular compromisation, we should take rapid action to manage the case. And CT angiography is useful to delineating the extent of concomitant vascular injury. So CT angiography may be done when there is a risk of the vascular injury. So what will be our option? That means the Gastello-Anderson 1 or 2. What will be the answer? Here we can see the answer is the intravenous antibiotic, photography, application of saline soak gauze within the impermeable dressing. And the scenario was the open fracture of the tibia, which is 15 centimeter wound. But here important note that the neurovascularity is intact. Now see the second option. Second option is through wound debridement in emergency department. It is not required, because the though it is open fracture and about 15 centimeter wound, but there is neurovascularity intact and there is less tissue injury. So in this area, the wound debridement usually not required. Combined skeletal and soft tissue reconstruction on a scheduled operating list. It is also true that it is the definitive treatment, but here in the option they want to know about the initial course of action. That means a fracture patients come to hospital, what is the first response? The first response is the first one. So the schedule operation, it is the next and definitive treatment. Application of external fixator, conversion to internal fixator after 2 weeks. This also not required in this phase because there is the fracture, but is there any displacement or anything? They are not denoted here. Immediate skeletal stabilization and application of the negative dressing, it is also not required. So our answer is the intravenous antibiotic, photography, and application of saline soak gauze with impermeable dressing.